Welcome to Expanding Access, a podcast by Behavioral Health Tech, where we explore the cutting edge of mental health, substance use, and autism and IDD care. Each episode features insightful conversations with industry leaders who are driving real change through technology and innovation. Whether you're a provider, payer, or just passionate about expanding access to behavioral health care, you won't want to miss these stories. Let's dive in. Hello, everyone. I'm Solome Tibabu, your host of the Expanding Access podcast here at Behavioral Health Tech. And you might recognize we have a part 2 with our special guest, Kacie Kelly here. And that is because we were both just up in Washington, D.C. last week. But before we tell you all about that, I would like to just refresh folks on who Kacie is. We just had a phenomenal episode with her and Talisha Searcy from ASTP. If you have not listened to that episode, I highly recommend you do. We'll include it in the show notes. But just a quick refresher, if you don't mind, Kacie, who are you and who is Meadows Mental Health Policy Institute?
Thanks, Salome. I'm delighted to be back. Thank you for having me back. And thanks for referencing that show with Talisha. It was awesome. And I do hope folks will tune in. At the Meadows Institute, we are an independent and nonpartisan think and do tank, if you will. We operate at the intersection of policy and programs, where we go into health systems, school systems, and justice systems and help those systems implement best-in-class innovative programs so that we can drive systemic, equitable access to high-quality mental health services. As the Chief Innovation Officer at the Institute, I get the good fortune of leading our work with entrepreneurs and investors who are building better mental health solutions, and to help them understand why they should care about policy and to learn the barriers that they may be experiencing in their innovations that could potentially be addressed through policy change. And we see digital mental health tech as a critical component in our work in a comprehensive approach to optimizing our existing workforce, expanding access to quality care for more, and ultimately improving outcomes.
Awesome. Well, I know this has been a busy last few years for you and your team, and just would love to share a little bit about the event that we're participating in this past week in Washington, D.C. There were so many digital mental health companies to basically educate and engage leaders in the industry alongside policy partners, and would love to just discuss what was the event all about? What were some highlights for you?
Well, first of all, thank you for helping us with the event and for attending. I know how busy your schedule is and really appreciated you making the trip all the way to DC. Ultimately, our goal in doing this event was to bring together roughly around 65 diverse stakeholders across the sort of tech ecosystem and the policy ecosystem, and curate a really fast-paced and interactive agenda that would expose them to data-driven solutions and also facilitate working together to address some of the barriers that we know exist for scaling those innovative quality solutions, with a specific focus on tech-enabled, measurement-informed care. As far as highlights go, it really was a joy to see my team in action. They did such an incredible job with the event, and I'm just very, very proud of them. I love bringing people together who are often not in the same room and sometimes have never even met to try to tackle complex challenges. And it really was inspiring and productive to have leaders from the tech community engaging with leaders from the policy community, together wrestling with some of the challenges we have related to scaling higher quality mental health solutions. And some of that includes like responsible use of AI, that's on everyone's mind these days. Other topics that we covered were, how do we improve our workforce proficiency in their use of tech and their trust in tech, and so much more. But I will say, I think my favorite session was the one that you led for us. That would love, I have no idea, I haven't even talked to you to find out if you had fun doing that for us. But I just thought it was a really great opportunity for these diverse stakeholders to build some trust in working together to solve real world challenges that really no one's solving right now at scale, and to be forced, if you will, to be intentionally placed in a working group where we knew there was going to be some discourse and some healthy debate. And I just was really delighted to see the number of healthy and productive debates about the pathways forward and the potential solutions that we know exist. And frankly, think that we need to have more opportunities for healthy discourse in order to drive better innovation.
Yes, there was a lot of spicy conversation in the working group. So a huge, huge highlight, and grateful for the opportunity. It was exciting to see folks who definitely would not have been in the same rooms. And I'd love to just go back to this idea around startups engaging in policy. I mean, of course, I love that Meadows even has policy quite literally in your organization's middle name. But I've found that many founders in our ecosystems may not think that policy is relevant or a priority to their work. Can you just emphasize a little bit about why, especially now, why is it so important for entrepreneurs in behavioral health and beyond to be paying attention to policy?
Yeah, thank you for that question. Policy is not always the sexiest, most exciting word in any conversation. But at the Meadows Institute, we believe that the next decade of mental health and brain health innovation will not be defined by who actually builds the best product, but will be defined by who anticipates the policy pathways that can bring that product to scale. We're in a fascinating moment in time in healthcare tech overall and healthcare innovation overall. We're seeing significant investment and innovation in mental health and neurotech. Really is booming and exciting for my entire 25-year career. I'm really excited about what's coming out and what we can say related to data-driven solutions. But unfortunately, adoption is not keeping pace. And we all know about the first valley of death, the classic failure between research and commercialization. But what's less talked about and less well known, which is where we're starting to really focus our time and energy, is in the second valley. That valley that hits when even successful demonstrations can be pointed to, but when a founder or a company may have traction and evidence, but haven't really thought through the reimbursement pathway, the regulation, or the potential policy inertia that may be stopping them from growing at scale nationally.
Yeah. Can you talk a little bit more about that? Because I think that would be very relevant, this idea of the second valley of death, to a lot of startups in our ecosystem who've maybe had funding rounds up until this point and really should be starting to think about these things, but haven't yet.
Yeah, well, busy entrepreneurs are working so hard to make sure the solution, the product they're generating, is data-driven and can be commercialized. But that second valley is really about the scaling phase. And within the policy-driven system that we have in the United States related to how healthcare is financed, that system moves much slower than venture timelines. But ultimately, policy does shape everything. Federal and state rules determine who pays for what, when, and how. And there really isn't any other sector that's so dependent on policy to define its market value. And so startups really do need to be thinking earlier than they are today and how they're going to plug into what is, by many accounts, an antiquated healthcare infrastructure, including things like electronic medical records, fragmented billing codes, state licensures. And that integration cost at that stage can be enormous. And many founders, unfortunately, dismiss policy early in their business development, but that delay will create barriers for them down the road that prevent them from scaling or stalling. I think the other thing that I have learned that we talked about actually at the event last week was that many founders don't realize how past policy impacting their current challenges and their ability to scale and ultimately their bottom lines. Take, for instance, the High Tech Act that we talked about last week. That piece of legislation catalyzed updates to our healthcare tech infrastructure in the United States and provided incentives for companies to integrate into EHRs, but behavioral health was largely left out. The good news is the federal government today is showing interest and taking actions to update elements to that tech infrastructure that could support or potentially impede opportunities for digital mental health companies to get their products into clinicians' hands and to have them paid by Medicare or Medicaid.
And there's something empowering about that too. I know for me, it's like, what can I do? There's more we could be doing, and just getting involved early and educating ourselves of the opportunities. That's even just the first step. So would love to talk a little bit about how can founders avoid that second valley of death? And in fact, at the moment of this recording, we're currently in a government shutdown. So it just seems this environment is rapidly evolving and changing, and it's been a challenge to keep up. So yeah, help us with a little advice around these pitfalls.
Yeah, well, it absolutely, I mean, I want to sort of appreciate the confusing and complex nature of our federal government, our state government, our policy landscape overall, even when there isn't a government shutdown, and even more so when we are in the situation that we're in now. The biggest thing that I want to encourage founders to consider, and their investors, as they're thinking about how to navigate and avoid the second valley of death, if you will, is to shift towards treating policy as a growth tool. Policy can be, or is actually, a gatekeeper to success. So if more founders could treat policy as a growth tool, map these reimbursement opportunities earlier, and align how they're thinking about their strategic growth geographically through that lens, I think it would go a long way. We know that Medicare is the domino. Even if your target user is not Medicare, its coverage decisions at the federal level shape Medicaid and private payers, and national coverage determinations can sometimes take up to 2 years. Additionally, we know that Medicaid adds a whole different level of complexity on top of that. But founders who are on top of these things can reduce adoption delays and not be stuck in that second valley. There are additional non-dilutive funding opportunities still available at the federal level through ARPA-H and NIH even, that can help build credibility. But unfortunately, venture timelines and policy timelines are fundamentally misaligned. And policy preparation must begin earlier in order to bring the gap in those timelines more closely together. And so we're really encouraging founders to recognize that they need this early foresight or insight into the federal landscape, and to really see it as an offensive strategy for them that they can use as a growth lever to gain first mover advantage, to help better position them so that they don't burn through that precious capital while they're waiting for adoption through the healthcare financing lanes. And so, we're really encouraging founders and investors to start looking towards this foresight at the federal level at or before Series A.
Really great points. And you mentioned both founders and investors alike. Could you share a little bit about how the Meadows Institute is actively helping these groups with understanding some of the challenges you've outlined here?
Well, one of the ways that we're helping is supporting them through understanding what's happening in the sector overall and helping them pay attention to that. And so, for example, we do know that global digital health investment peaked in 2021, but behavioral health does remain a bright spot, still attracting 20 to 25% of all digital health deals. And while valuations are down and exits are rare, we believe that investors are looking for defensible models, and policy foresight is one of those few defensible levers that are left. And the next wave of winners will combine that sort of clinical validation, that high quality product, with their payer alignment and capital efficiency, and see policy as an infrastructure opportunity, not an interference that needs to be worked around. And so we're helping and founders try to understand the sorts of dynamics that we know exist in the larger ecosystem. Another example is everyone's sort of paying attention to virtual only care that's peaked and then now coming down. But hybrid models are rebounding, and demand for certain populations is growing and unmet and untapped. And so we're encouraging the companies that we're working with to pay attention to which segments of the population have still been untapped. Medicare Advantage, for example, is growing while employer plans remain flat. But practically, I'll just offer smart founders, to reiterate, the risk of reiterating, really do need to be reframing their policy investment as a strategy, not as compliance. And those that do that will be ahead of the game. They'll be better positioned to map their reimbursement pathways earlier and identify opportunities for some of the capital that exists that's non-diluted at the federal and the state level. As for investors, we would encourage investors to include reimbursement readiness in their diligence processes, to fund policy foresight earlier, to help to de-risk the investments that they're making. And we really do believe that having that investment in mental and brain health, that policy foresight is going to be a survival component. And those that are able to invest in mapping the policy path as carefully as they build the products and the product quality will be the ones that cross over that second valley of death.
That's so great. Policy as a strategy, not compliance. Compliance is just barely scratching the surface of the opportunity here. Where can folks learn more?
I mentioned on our last podcast really quickly, but I'd like to reiterate it again. I'm really, really excited about a new offering the Institute has made available to early stage companies and investors. We are excited to be helping founders and investors tackle some of these really complex problems through an offering we recently launched called HeadsUp. And it's designed just as it sounds, to provide that heads-up insight or foresight, if you will, to help our great innovators be able to navigate this complex federal system and identify those pathways that will support their revenue growth sooner than later. And it reflects our commitment to transforming mental health care through evidence-based policy, innovation, and cross-sector partnership. And through HeadsUp, we're designing the consultation service to equip entrepreneurs and investors with those insights and help them accelerate the adoption of their solution, expand access to high-quality, innovative outcomes so that more people ultimately feel better and strengthen our mental and brain health ecosystem overall. And the fact is, with all the uncertainty that's happening right now in our federal policy landscape, HeadsUp is a great resource and an anchor point for folks who may not know where to turn to help them understand the headwinds that may be on the horizon or the potential tailwinds. This month, we're going to cover just a few things in our consultation. It's actually later this week, and I'm really excited that we're going to be able to talk about the latest impacts on the federal shutdown on our sector. FDA has requests for feedback on AI-enabled devices that we're going to be able to share. There also is a new funding opportunity coming out through a Rural Health Transformation Fund, and we have some details on that to share. CMS has finalized a new Medicare provider directory and rules, and we're going to be able to talk about that a little bit more in depth. And really just excited to see the questions that we're going to get from those who have joined us, because we really want to design this in a way that meets entrepreneurs and investors where they are and provide the critical intel that they need.
It just sounds like a wealth of knowledge and resources. So I really encourage our audience to learn more. And of course, the Meadows team will also be at the Behavioral Health Tech Conference, where we'll have plenty of juicy policy content as well. So November 11th through 13th, save the date.
So I am so excited to continue the conversation at BHT. Thank you for once again hosting what I know is going to be the best convening on the planet. And we're really excited to be there to not only continue this conversation, but to learn and hear from the community that you've built so that we're working to improve the solutions that we're designing from a policy perspective to be the most helpful that we can be to the community.
Thanks so much. Yes, we'll have a great time. And for investors and startups alike, if you want to be well-rounded and ahead of the curve on all of these opportunities with policy, definitely learn more. And once again, thanks so much, Kacie. Such a delight having you, as always.
Thank you.
Thanks for tuning in to Expanding Access. We hope you're feeling inspired by today's discussion. If you've enjoyed the episode, subscribe and share it with your network. For more content and opportunities to get involved in transforming care, visit behavioralhealthtech.com. Until next time, let's keep pushing boundaries and expanding access together.